Hello. I have no idea if this is actually working, so I am going to assume that is. I've got the chat going on. Type in the chat if you can, if you can hear me. I think, let's see. I see some people giving thumbs up. I'm going to give it a second while everybody gets streamed in. This is the first time I've ever done this, so welcome to a live stream. I see some eyeballs popping in. We're reaching some double digits, okay? All right, so yup, all right. Well, guys, thank you so much for joining. I'm amazed that I'm amazed that we're here, actually. And I'm going to hope that technology doesn't fail me here. And I'm actually going to share a presentation that I made. And I really want to, for those of you who have never actually heard the kind of the why. And I'm hoping that everybody can see. So somebody text me now. If you could see my screen, just let me know. But you don't want to see that screen. You want to see this screen. So I'm hoping that you can see the screen and you can see the right screen. So somebody give me a thumbs up if you can see the right one. I want the full picture. So I'm going to walk you through a little bit of the story here. And the reality of it is, in this insurance world, nobody wakes up in the morning wanting to be in the insurance world, right? We normally have a reason you got into insurance. A lot of people's parents, were in the business. They were, something. But my story starts a little bit different. My story, for those of you that have never known, I was born and actually lived in San Juan, Puerto Rico. And we moved to the States when I was 3 years old. And my parents were the two most amazing people. I grew up not knowing a whole lot about anything different than a nice middle class American family. My parents were the two hardest working people you could possibly think of. And my life completely changed when I was 15 years old, when this man, and any boys out there know that your dad is like Optimus Prime. He cannot be hurt. My dad was diagnosed with multiple myeloma. Now, multiple myeloma is cancer of your bone marrows. My dad had a bone marrow transplant, chemo, radiation, hundreds of thousands of dollars in expenses. And when I was 17 years old, my family had to file bankruptcy. Now, I didn't really understand what that meant because my parents were still putting Jordans on my feet, Z Cavaricis on my bottom, sending me to baseball camps, doing everything they could. So I really didn't understand the magnitude of what it was until I really went away to college. And I was fortunate enough to go to an amazing school, Florida State, go Noles. And Florida State had an insurance program. So I'm like, man, my parents are giving me $250 a month out of my dad's disability policy. My dad went through all this thing. I was born to be an insurance professional. I've had an amazing career, and have been blessed to be insanely successful. And my life in 2014 changed again, where I don't have to tell you guys, anybody who knows me, any Latin boys out there know that I am, was, and will always be a mama's boy. And in 2014, my mom was diagnosed with pancreatic cancer. And I remember having a conversation with her about her outlook. And the one thing that she said is, she said, promise me that you'll never, ever live the rest of your life having any level of regrets. And the one thing that came to mind at that very moment is that I was not doing anything different in this business. I was just one of those people that were doing exactly the same thing as everybody else. And so that day I decided that I was going to dedicate my life to doing something different. And so the reality of it is the last 5 years of entrepreneurship, I left a 13-year career at the third largest insurance consulting firm in the world. I was the chief growth officer of North America. I ran a $350 million practice. I had 200 people working for me, but I realized that I was just part of the problem. I wasn't actually building a solution. And that's the essence and everything about impact healthcare. And I really want to focus the time that I've got and bring on one of my clients. Now, Impact Healthcare, I want to, oh man, I see so many faces chatting me up. Man, I didn't see this until now. I'm super pumped. This is awesome. So Impact Healthcare, this has been a dream of mine for over a year. And quite honestly, guys, you know I'm not lacking in any self-esteem. But this was something that I had a lot of imposter syndrome on. I would start planning and I'd be like, man, who's going to come on a podcast and listen to me about anything? And it wasn't until I started to have the focus, and it was during COVID, that so many employers were struggling with healthcare costs. And we actually had clients that told us, because we did what you guys showed us, we didn't have to lay off hundreds of employees. So I was like, you know what? I would actually be doing myself a disjustice if I didn't do this. And so I'm going to bring on the star, the show, Dylan, stop picking your nose if you are, buddy, because I'm coming to grab you. And I'm bringing on one of my favorite people. And so, you know what's interesting about Dylan, from the first time I met Dylan, I knew we were going to be buds. It was a quick meeting, but one of those people that you knew absolutely get it. So Dylan, first of all, we've got 30-something people on, and I think there's people streaming on other platforms. So say hello to the Impact Healthcare crowd, Dylan.
All right. Thanks so much. Guys, hello. Glad to be here today. Excited to be talking with Lester about something that's incredibly important to both of us and obviously to you as well. So thanks for having me.
Yeah. So Dylan, I wanted everybody to get a flavor of what Impact Healthcare was. And I thought that there'd be no better way than to give them a recap of our jam session. When I was reading a book about how to be a podcast host. Now, I'll get on stage, I'll get in front of a camera. I have no problems, but I didn't really know what a podcast was supposed to be all about. And the main things that you always kind of read about there is let the speaker drive the show, make it all about teaching people and just giving other people. So the one thing I want to tee up this conversation is you are the Chief Wellness Officer. So I want you to introduce yourself. What the heck is a Chief Wellness Officer? Tell us a little bit about PTTG, but the real important thing that I want you to give as a flavor of the essence of Impact Healthcare is, why is it so important that we start thinking about healthcare, health benefits, health insurance differently? So give me who Dylan is, PTTG, and why is this even important?
Yeah, so Chief Wellness Officer, it's an interesting title, and we are honestly trying to continue to figure out what that means. What we know for sure it means is that I have to be and am one of the most caring people in our organization about our employees. I mean, that is who I am through and through, number one. It's not a bragging thing. Sometimes it's to a fault. It's an opportunity for me to show my care through how we serve our employees and ultimately find ways to serve them in ways that are affordable and sustainable. And when it comes to benefits, I mean, that's an obvious opportunity for us, specifically when we're moving away from the traditional type of benefits into the transparent benefits that we have today. Pittsburgh is a 102-year-old company now. Yeah, family owned since the beginning of that. We're blue collar, and we love it, love working together, and we love working for the same goals. And ultimately, those goals are, and my CEO would tell you this, to afford the American dream to our employees. And that's what our heart is for. And that's what we're moving in the direction of with our transparent benefits plans.
So Dylan, you guys are an ESOP. And for those of you out there that don't know what an ESOP is, it means all of the employees own a little bit of the company. And when the company profits, the company deposits into each of the employees' accounts more money. And so, Dylan, I want to ask you a couple questions so people understand the magnitude of health benefits for most organizations. I always say the stat that health benefits is number 2 or number 3 as far as the top 3 expenses of any organizations, right behind the salaries you pay employees. Would that be the same in Pittsburgh?
Yeah, definitely. It's number 2 for us.
Okay, and so I'm going to assume your employees don't want to take a pay cut. And so cutting cost of benefits is the second most impactful thing you could do. Fair?
Yeah, completely.
So you guys have done amazing things, and I don't want to take away from the podcast because I want people to actually tune in, but give me one example of the things that you're doing as a pioneer, as a trailblazer. Give me one example of how the organization has been. Well, let's start with the employee. Let's start with the employee. Let's give one example of how a member, an employee, one of your employees, one of their spouses, one of their kids has benefited from the new structure of the health plan that you've been able to achieve.
So I got a call. This has been 4 weeks now, maybe 5 weeks ago now, from one of our employees. And literally, he accidentally called me. He was trying to call his daughter. And I don't know if I was number 3 on the speed dial and she was number 2 or what happened there. But as soon as he got me on the phone, it was like 7:30 at night or something. He said, "Oh, sorry, Dylan. I was trying to call my daughter." And I said, No, I need to talk to you. He said, "About what?" And I said, "Well, I'm writing a company newsletter and letting them know how our new plan is working, in your life and the life of those who have utilized it." He said, "Absolutely. You can write anything you want about me. You can tell them, what I'm dealing with as far as my illness and so forth. But what I want to tell them is this: I've had good insurance, I've had bad insurance, and this is by far the best insurance I've ever had." I said, "Man, I'm completely honest by telling you this. I never thought I would hear anybody say that about any insurance program ever as a member, right?" So I said, can you unpack that a little bit? Why would you write that down for every other employee in our organization to read? And he said, ultimately, 2 things. Last week, I got a scan performed by an incredible staff that cost me nothing. And I know for sure, because he was on our transparent plan, which is a high deductible plan. He said, "I know for sure it would cost me at least $3,000. And I said, "Friend, it would cost you $4,200. I already did the math." And he said, "Well, look, you saved me $4,200 there. And then this morning I go in and pick up my medications. They're usually $10 for a month's supply. They gave them to me for $10 for 3 months supply." He said, "I'm getting everything I needed and more, and it's cheaper than it's ever been. How could this be anything but the best plan we've ever been on?" And so that is one of my favorite examples of how this plan is impacting our employees, for sure.
Man, I love it. And And, when we talk about whys and missions, and I've shared this with you, and this, filing bankruptcy when you're 17 years old, having 2 parents who have passed away from cancer, the thought of waking up and allowing other people to go through what we had to go through, just it doesn't even comprehend for me anymore. And so when I hear these stories about a $4,000 savings on somebody, Dylan, your average employee making less than $40,000 or $50,000 a year?
Probably right in the middle, yeah.
Right in the middle. So $4,000, that's 10% of their take-home pay gross. It's probably more like 15-20% of their net take-home pay. And all because we shepherded them to the right spot. So first of all, Dylan, thank you for being such an advocate of mine, an advocate of change, and just an all-around awesome dude. Thank you so much for being my first guest of my podcast. And we're going to keep monitoring you over years because you're stuck working with me forever. So I appreciate you. And then everybody that's tuned in, I am going to drop a text into the stream. So here's my request. The podcast is live wherever that you actually listen to your podcast. So first of all, go, whether you want to go to impacthealthcare.fm, you could drop it there. But wherever you go, if you could do me two big favors. One is subscribe. I'm not going to spam you with anything. It's really just a matter of, it's going to send you a notification when we drop another episode. If you can share this. So we're going to post something on all of our socials right after this with a link to the page. If you could just share it. And if you want to listen, it's a fantastic episode. You're going to hear the passion that Dylan and I both have. And more importantly, you're going to hear some amazing stories like the one he just said. All of you are consumers of healthcare. So whether you're in this field, I see some family members on, whether you're anybody, you consume healthcare, and doing it a different way is absolutely the right way. So thank you so much to everybody. Again, text 813 or text Impact Healthcare to 813-537-6992. You'll get in our text community. It'll pop you a text every time we drop a new episode. Again, impacthealthcare.fm. Subscribe, share. Thank you to everybody who made this possible. My marketing guy, Adam, who just rocks everything that there is for THP. My assistant, Gina, thank you for dealing with my crankiness over the last couple of weeks. Dylan, thanks for being my first guest. And everybody, thank you so much for supporting us. We look forward to keep on dropping better and better things. And we'll see you guys soon. Take care, be safe, and we'll talk to you soon. Thanks.